Hi everyone! Today we will be looking at cardiac imaging. Most importantly, the comparison and assessment between different imaging modalities. Cardiac imaging allows images of the heart and cardiovascular system to be viewed by medical professionals and used for diagnosis and monitoring of cardiac conditions. In this presentation, we will discuss how 3 different imaging modalities are used for cardiac imaging and alongside their pros and cons. The modalities we will be discussing are CT scans, MRI, and nuclear medicine. So, why is cardiac imaging so important? The heart is one of the most important organs in the body and is vulnerable to conditions which are difficult to diagnose without images and which require continuous monitoring. These conditions include heart disease, leaky valves, blockages in blood vessels, aneurysms, and defects in size and shape of the heart. All of these require imaging for diagnosis. Chronic conditions require regular updated images, so easily accessible and affordable imaging modalities are very important. Additionally, as the heart is such a complex structure, highly detailed images are preferable for diagnosing and monitoring cardiac conditions. So now we will be talking about CT scans, or also called computer tomography. This can be used for imaging the heart through CT coronary angiography. CTCA uses CT scanning technology to capture angiograms of the coronary blood vessels of the beating heart. CTCA uses contrast medium injected into the veins that's usually in the arm to increase the density of the blood in the vessels and allow the structure of the vessels to be imaged clearly. Sometimes medication to reduce blood flow and heart rate is also administered to further improve clarity of images. CT coronary angiography is very effective in diagnosing and monitoring narrowing of arteries and blockages. Next imaging modality that we will be discussing is the MRI, also known as magnetic resonance imaging. The cardiac MRI operates in the same way as a normal MRI, with the focus on the heart and the surrounding blood vessels. Cardiac MRI can also produce detailed images of the heart and the surrounding structures to diagnose and monitor various cardiac conditions, such as hypertrophic cardiomyopathy. Cardiac MRI is also useful for providing additional information on top of other tests. And lastly, we will be talking about nuclear medicine. Unlike the other modalities, which take images of the tissues of the heart, nuclear imaging produces images showing the movement of blood through heart. This type of imaging can show any blockages or narrowing within the heart and surrounding major blood vessels. Nuclear medicine uses a machine called a gamma camera to detect the movement of blood. For the gamma camera to detect the blood flow, the patient is injected with the radiotracer, which is picked up as it travels through the heart. As the movement of blood through the heart varies throughout the day based on the movement of the patient, a scan is taken once at rest and again after the patient has undergone physical activity. To compare, these 3 imaging modalities all offer different benefits and diagnostic possibilities, but also have their own drawbacks. In terms of radiation exposure, MRI is the safest as it does not use ionizing radiation. However, it does pose a risk to patients with metallic implants such as pacemakers. With that being said, MRI-compatible implants are becoming more common, meaning MRI is increasingly possible. CTCA also has the risk of allergic reaction to the contrast medium that is injected. In terms of cost, all modalities are quite expensive. However, CTCA is regularly bulk billed, while MRI is bulk billed only in the very specific cases, and nuclear medicine is not covered at all. MRI and nuclear medicine are difficult to access, especially in rural areas, while CTCA is more common. Of diagnostic possibility, MRI is the most versatile with the ability to detect the various conditions, while CTCA and nuclear medicine have more specific capabilities. As CT/CA images the blood vessels, it is useful in diagnosing and monitoring coronary artery diseases and blockages. In contrast, nuclear medicine does not image tissues but rather the blood flow through the heart. It has the advantage of taking images of the heart in different states to diagnose problems that may only be visible during or after the person has physical activity. The main disadvantage is that it doesn't show any tissues in the scan. Mortality is found in nuclear medicine. Patients may need to follow up with a CT or MRI to determine what's causing the issue. However, the radiation dose is lower than CT. To conclude, each modality have different diagnostic capabilities while also having their own disadvantages. Patients need to discuss these pros and cons of each imaging modality with their healthcare professional before undertaking any of these scans so they understand the risk and rewards of each. Thanks for watching.